Our News is brought to you by Alive.
Tonight on Our News, healthcare providers speak out on conditions at PMH. Business owners slam unfair restrictions. Plus, BPL explains recent power outages. Welcome to Our News and thanks for joining us. I'm Christina Dragovich. Topping news tonight, amid an increase in COVID-19 cases and 2 new deaths, 2 healthcare workers on the front line of the COVID-19 fight are speaking out on conditions at Princess Margaret Hospital. The CPSA president called a video of patients sitting in the rain on the porch of the critical care block a sad day in healthcare. Giorgio Bain reports.
It is sad. It is really a sad day for us.
As COVID-19 cases, hospitalizations, and deaths in the country soar, President of the Consultant Physician Staff Association, Sabrika Pinder-Butler, says a video that went viral over the weekend offered a glimpse of the grim situation that patients and healthcare workers at Princess Margaret Hospital are facing.
If your healthcare institution is failing and is about to collapse, which I think is where we are right now, I think that we need to do a better job.
The video shows 8 patients covered by hospital blankets crowding a small porch of the critical care block as rain pours down. Some patients were in beds while others sat next to oxygen tanks. PHA said in a statement on Sunday that the area shown in the video is the triage site for the Accident Emergency Department, adding patients are screened for COVID-19 in keeping with the hospital's prevention measures.
It looks bad when you walk into the entry of a new block that just was built recently. It looks bad. You're serving patients in the front. I understand that you want to triage patients before they get to the back of A&E so you could avoid the patients that came in with emergency will not be exposed to COVID patients. Okay? But yes, that is the reason why you've had tents.
Officials have said that the hospital has reached its capacity for COVID-19 admissions. 92 COVID-19 cases are hospitalized. 10 of them are in ICU. Health officials are also reporting 133 new cases. According to Pinder-Butler, the only solution now is to bring those doctors and nurses who are at home waiting for the public hospital authorities' call. She said that the current doctors and nurses are beyond their breaking point.
We've lost some of the SHOs, senior house officers, who are waiting to return to work. We've lost other physicians from the beginning of the year whose contracts were not renewed. We just don't understand, honestly, how persons can lose jobs at a critical time.
Williams says in addition to fighting fatigue, they are also losing colleagues to the virus.
We've lost 3 nurses COVID, okay, in 2020. In 2021, we've lost 1 from Grand Bahama and 2 from Nassau. Not providing, people say, oh, they were not vaccinated. Really? Morale of the nurses is up to the floor.
Reporting for Our News, I'm Giorgio Bain.
Despite a major staff shortage, more than 30 junior doctors remain at home waiting to be brought on by the Public Hospitals Authority. Our News understands those doctors have not even received calls for interviews to begin the process. PHA Managing Director Catherine Weish says they will be hired as senior house officers as soon as possible. However, they will be required to complete an extra 2 months of internship.
We're going to have to seek to have their stay with us extended for a period of about 2 to 3 months, simply to allow us to be able to transition the new interns. We're having to do that simply as we are currently in a crisis, and the period of time between the SHO, the interns being appointed, and the passing out period, the need for that is definitely necessary.
The move to ask the interns for an additional 2 months is out of the norm, which says new interns are set to come on board soon as well.
We anticipate that by Monday of this week, we would be in a fairly good position to know who of those individuals that sat the final exam have been successful. That will allow us the opportunity to have those interns that are posted in the Princess Margaret Hospital deployed there to be able to take on that category of service that they provide.
Well, PLP Deputy Leader Chester Cooper is questioning the rationale behind some of the latest COVID-19 restrictions, saying he feels the Prime Minister is just trying to be re-elected. Kyle Joaquin has more.
Forget running the country, forget being Prime Minister, forget being a physician. What he is now looking to do is try to win an election.
Cooper says that's really what it looks like, as he feels a number of the restrictions do not make sense.
Everything you see now, you have to remember that this is silly season. This is election time. And I think at this stage, the Bahamian people trust very little of what he says.
Among the restrictions, no indoor funeral services, only graveside services with a maximum of 30 people. However, indoor weddings and church services can still take place.
Seems to be a bit out of whack. People have lost loved ones, especially during this period. And it's the Bahamian way of putting down loved ones very decently and in order. We understand the COVID guidelines, but when we look at the misalignment, we wonder whether there's rational thought.
Then there are some restrictions like no sporting activities, which Cooper says threw a wrench in plans he had for children in his constituency.
I am in a position where I have to look at whether I cancel my basketball camp in Exuma because the orders prohibit sporting activities. So what this is going to do during a time when young boys are out of school is really going to keep them on the street rather than as a part of wholesome activities.
People on the campaign trail also now required to be vaccinated and only travel in groups of 5. Cooper says while the PLP supports vaccinations, he wonders how that's going to work and whether that move is even legal.
So how do you say to a canvasser that you cannot canvass unless you're vaccinated? Or how do you say to a candidate that you cannot canvass unless you are vaccinated? There has to be something legally and constitutionally wrong with that.
Now, Minister is set to give a national address on Wednesday. It is expected that then he will say more on what's to come in the fight against COVID-19. For Our News, I'm Kyle Joaquin.
The latest round of COVID-19 restrictions are also cause for concern for local restaurant owners who fear it could hurt their business. Indoor dining capacity is now limited to 33%, and with the nightly curfew back to 10 p.m., managers at Cafe Johnny Canoe say it will impact employee hours.
We've had to cut back in terms of how we work, almost 33% of the team members. So in addition, what we're seeing is being a recovery period for us. We're now seeing as what you call it, a fall short in terms of business for us.
We'd like to have customers enjoy the experience. So and we're not quite sure if we understand what the hour does. Does COVID change an hour later, an hour earlier?
Over at Manuelo's, owner Emmanuel Gibson says while he understands the restrictions, they will have a negative impact on his bottom line.
I understand what they're trying to achieve, and certainly from a restaurant owner standpoint, it's a hard thing because during this last lockdown, it was kind of making some pickup, in terms of the customer comeback.
It wasn't lost on business owners that these restrictions do not apply to hotel properties.
It's not fair play when you have government telling us one thing and telling the hotels another. We find a problem with that.
In other news, following multiple power outages across New Providence, Bahamas Power and Light Chairman Dr. Donovan Moxey is calling on consumers to bear with the electricity company as it seeks to address transmission and distribution issues. He insists the outages were not due to load shedding, adding BPL is doing the best it can with what it has.
The outage last night was actually due to a T&D event. There was a disruption on one of our substations. And so what ended up happening is that particular fault propagated through the entire network. It should not have propagated the way it did. Obviously, our engineers are looking at that to determine why it propagated. And so from our perspective, we're looking to make whatever changes need to be made so that whenever those kinds of faults occur, we can contain those and really minimize the impact to our particular customers.
Moxey says BPL is working to improve service and upgrade its network.
One of those things where you're trying to do the best that you possibly can with the existing infrastructure, recognizing that you cannot make the significant investments that are required to make a smarter, more hardened network.
A rainy morning in the capital today. Greg Thompson is in the Weather Center with current conditions.
Thanks, Christina. Welcome, everybody, for your first look at weather on this Monday evening. Very warm day around the islands. Once again, summer-like temperatures and humidity out there. We are settling into the low 80s, 83 outside our studios. Few clouds, muggy conditions, winds out of the southeast at 5 knots, and your feels-like temperature in the mid to upper 80s. Satellite view, quiet around the islands. That low-pressure system we were watching is pulled north and west of us, but we still have some trailing moisture across the northwest Bahamas in the form of isolated showers and thunderstorms. We'll continue to see that throughout the night. That's your first look at weather. Your extended forecast is still to come.
Still to come on our news, nurses slam talk of mandatory vaccinations, plus more than 192,000 names on the voter register. The details after this.
Welcome to our news and thanks for joining us. Topping news tonight.
COVID-19 remains a serious threat.
Coronavirus COVID-19 has disrupted our economy, tourism industry, educational system, and put our healthcare facilities and professionals on high alert. Are you prepared? Do you have all the facts? Stay tuned to this network for the very latest news and information on this global pandemic.
Mandatory vaccinations for healthcare workers is a hot topic today, not just locally, but also in the United States, as dozens of medical groups representing millions of doctors, nurses, and healthcare workers called for the mandatory vaccination of those groups against COVID-19.
So if I don't do it, what you going to do? Well, tell me what you're going to do. Sure. You have a shortage already.
Bahamas Nurses Union President Amancha Williams pushing back against talk of mandating COVID-19 vaccinations for healthcare workers in the Bahamas. The country is facing a vaccine shortage, awaiting the third tranche of AstraZeneca vaccines through COVAX.
I can't support that. I can't support that you make it mandatory because people have beliefs and people need a little bit more time to make their choices.
During the Ministry of Health's COVID update on Friday, Chief Medical Officer Dr. Pearl McMillan indicated the topic was up for discussion in the Bahamas as healthcare providers help to influence the care decisions of their patients.
A recommendation would have been put forward for consideration of mandatory vaccinations for healthcare workers because of the significance of that group.
Williams agreed that nurses and providers influence patient choices, but she says the fact that nurses have been slow to vaccinate shows that the government's campaign needs work.
I would go out to the various hot spots, set up my booth. I will camp, just like how they campaigning to get the vote, that's the same way how they should campaign to get vaccination.
In other news, 192,397 names are now on the voter register, according to the Parliamentary Registration Department, which saw a jump in registration last week. However, that slowed to a trickle today. Jasmine Brown reports.
From the head office of the Parliamentary Registration Department to the registration site at the West Bay Street Post Office to the registration site here at the Town Center Mall and even as far as the Elizabeth Estates Post Office, lines at registration sites across the island were nearly non-existent. It was a far cry from the chaos of long lines and even longer waiting times 1 week ago when scores of residents flocked to voter registration sites across the island as talk of a snap election loomed.
Just hearing about it and that election could be called any minute. I don't want to get caught up in the last minute, so I said let me just try to get it out the way now, so I could be ahead of the process.
According to the latest numbers released by the Parliamentary Registration Department, more than 192,300 people are registered to vote. On Monday, those waiting in line like Stacey McCartney said they had nothing to complain about.
The process looks like it's going okay.
The rush to register last week came after Progressive Liberal Party leader Philip Brave Davis urged new voters to register, and House of Assembly Speaker Halson Moudry said he believed Prime Minister Dr. Hubert Minnis would have dissolved Parliament last week Tuesday. When asked how he felt about a possible early election in the midst of a third wave of COVID-19 infections, Bishop Dion Mott insisted the show must go on.
This is very unprecedented. We have never been here before in terms of this COVID-19 pandemic. But elections is important.
As it relates to the pandemic, the numbers, there are some factors that should be taken into consideration. Presently, the serving government has a particular time frame in that office. At this time, that time is coming to a close for the present sitting government, and it is in the best interest of the country for there to be a general election.
Reporting for our news, I'm Jasmine Brown.
Up next, spa owners slam tightened restrictions, plus the latest from Tokyo 2020. Stay with us.
Welcome to our news and thanks for joining us. Topping news tonight.
COVID-19 remains a serious threat.
Coronavirus COVID-19 has disrupted our economy, tourism industry, educational system, and put our healthcare facilities and professionals on high alert. Are you prepared? Do you have all the facts? Stay tuned to this network for the very latest news and information on this global pandemic.
This is our news. Welcome back. Tightened restrictions for spas on New Providence aren't sitting well with business owners. Berthany McDermott has that.
I can see if everybody who is tested positive, a high percentage says, I went to the spa. But where's the findings to back up this decision? And that's all we want to know.
Spa owners on New Providence are slamming new COVID-19 restrictions as unfair and discriminatory.
Look at chiropractors. They are allowed to perform massages. Some chiropractors even perform facials. Dermatologists are doing facials. Men can go and get their hair cut and get their beards worked on. But again, I can't work on the face. That's discriminatory. Hey, just take a look.
As COVID-19 cases soar, Health Minister Renwood Wells announced on Friday that spas will not be permitted to operate, including for massages, waxing, threading, and facials. Owners say they were baffled by the announcement and question if there was data to prove spas contributed to the latest wave of COVID-19 infections.
Personally, I think it's a slap in the face because we have been operating with the highest standards of safety. We have done everything even beyond what they require of us.
We've done so much to keep things going. Last year, we were closed for a complete 4 months. And then when we had the weekend curfew that affected us, it's just endless.
The restrictions took effect today. Skin Solutions Day Spa and Salon owner Natilla Saunders said the short notice isn't good for business as the industry is still trying to rebound.
The core of my business is skincare. And so, because I can't, as a local spa operator, cannot offer facials, that's going to have a serious impact on my bottom line.
Spas at hotels on New Providence and Grand Bahama were not impacted by the latest rounds of restrictions, leaving business owners questioning what message the government is sending.
Locals can take a PCR test, go to the hotels, and have facials and massages done. So my question is, what separates us as local spa operators from the hotel?
I don't think that spas should be allowed to operate in the hotel, and local spas are to be closed. If you say that I am going to be closed or I should be closed, then what you're saying to the public is that spas are infectious. They are the ones that's causing this, the COVID cases to go crazy.
Now, while these businesses agree that safety is important amid the global pandemic, some say they're hopeful something's done to make doing business a bit easier. Reporting for Our News, I'm Berthany McDermott.
In other news, swimmer Joanna Evans back in the pool for Team Bahamas as competition continues in the Tokyo Olympics. Marcellus Hall has the latest.
Welcome to our sports, everybody. I'm Marcellus Hall, sports brought to you here in Tokyo.
courtesy of our friends at J.S. Johnson. Tonight, another of our Bahamian competitors back in the water, Joanna Evans, returning to competition. The thing about competition, it has a lot of different levels. There is, of course, the joy of victory, and the old saying goes, the agony of defeat. Joanna Evans experiencing the low end of that theory tonight as she unfortunately came up short. Let's take a look and see how it went down. Joanna Evans back in the water Monday as the heats of the women's 200 freestyle took place at the Olympic Aquatic Center. Evans, swimming in heat 3 out of lane 1, was hoping to record a good enough time to advance to the next round of the event. Unfortunately, however, it simply was not meant to be, as she would finish 7th in a time of 1:58.40. The time would be good enough for 18th overall finish, putting her 2 spots shy of moving on. Only the top 16 times advanced into the semis. A very distraught Evans, finding it too difficult to talk in the initial stages following the race, tearfully declining to speak with us, but did promise to make a statement at a later time. Meanwhile, Isaac Bastian makes his return to the pool tomorrow in the heats of the 200-meter breaststroke. And there it is, your check on Sports for you here this evening as the venue clears out here tonight in Tokyo. Once again, thank you for joining us. I'm Marcellus Hall. Back to you.
Thanks, Marcellus. Still to come, the Defense Force gives back. Stay tuned.
Welcome to our news and thanks for joining us. Topping news tonight.
COVID-19 remains a serious threat.
Coronavirus COVID-19 has disrupted our economy, tourism industry, educational system, and put our healthcare facilities and professionals on high alert. Are you prepared? Do you have all the facts? Stay tuned to this network for the very latest news and information on this global pandemic.
Welcome back to our news. Looks like another hot week ahead. Greg is back with the details.
Thanks again, Christine, and welcome back, everybody, for your second look at weather. Very warm day around the islands as that high-pressure ridge at the surface remains in charge. Low-pressure system we were watching over the last couple of days moving into the Georgia area. The National Hurricane Center gave it a 30% chance early today, and that will quickly fall off as the system moves inland. Upper-level low spinning to the east of the island will move towards the west. That will bring us an increase of some shower activity across the island, so a couple isolated showers and thunderstorms expected over the next couple of days. Beaching and boating weather for the northwest and central Bahamas tonight through tomorrow. Winds will be southeast to south, 10 to 15 knots. Seas running 2 to 4 feet over the ocean, while in the southeast Bahamas, east to south easterly flow continues at 15 knots. Seas running 3 to 5 feet. High tide will be at 10:41 tonight. Here's a look now at your national forecast. A look now at your extended forecast through Saturday. With those heat indices expected in triple digits, we're asking you to exercise extreme caution while you're doing some outdoor activities. Back to you, Christina.
Thanks, Greg. Finally, in news tonight, the Royal Bahamas Defense Force Supply Department donating much-needed items to the Mary Ingram Care Center. Officers and Marines showing their support for the community by presenting groceries, toiletries, and cleaning supplies to the care facility for the elderly. Officials at the facility expressed their gratitude for the items, which were a great help during the pandemic. Well, thank you for joining us for our news tonight. On behalf of the entire team, I'm Christina Dragovich. We'll see you right back here tomorrow night. Have a beautiful evening, Bahamas.